Hello and welcome to today's COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Minister of Health Dr. Frank Anthony reassured the safeness of the COVID-19 vaccine for persons living with HIV/AIDS.
It is quite safe. Globally, persons have been encouraged to get vaccinated, and so far, those persons who have been vaccinated, it has been very protective for these patients. So I would really encourage people to get vaccinated.
Minister Anthony said while the vaccination uptake for this group has been a challenge, a number of special programs have been developed with the aim of addressing this issue.
We have funded a number of informational sessions through the Global Fund with key population groups. So we have been having sessions with MSMs, with sex workers, transgender persons, and so forth. So we went to the key population groups and we've had informational sessions encouraging them to make sure that they get vaccinated. But the uptake is still not where it should be. Here in Guyana, despite the COVID pandemic, we have really worked to ensure that persons can access care. We have approximately 9,000 persons who are HIV positive, and we have kept our clinics open to make sure that persons who want to access treatment would be able to come to our treatment centers and get care. We have also changed the way that we dispense medication, because in the past a patient would be required to come to clinic at least every month. Now what we have been able to do is to give them a longer time period. So instead of a monthly visit to the clinic, they get medication for at least 3 months. We have also introduced some new innovations, and that is to help to reduce persons who might be at risk for HIV. So as of yesterday, we have 401,445 persons who would have received the first dose of a COVID-19 vaccine. That's 78.3% of our adult population. For second dose, we have 279,658 persons, and that would be approximately 54.5% of our adult population. In terms of persons between the ages of 12 to 17, we have 29,256 persons receiving their first dose. That's about 40.1% of that age cohort. And we have, for second dose, 20,473, or 28.1% of that age cohort. Boosters as well, so those who would have completed both doses, they should come back and get their boosters. If you had just the J&J, you should come back and get a booster after 2 months. If you had any of the 2-dose regimen, then you can come back after 6 months to get the booster dose.
That's it for today's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.